had to add some math problems. You guys added 3 or 5 math problems. Only the math that you've had, so chapters 1 through 5. Okay? You need to know specific hormones. It's going to be as simple as I'm going to give you a list and I'm going to say, what's a hormone? And you just have to pick it out. So you've got to know the hormones from the chapters that we've covered. You need to know what is the coordinating center for the nervous and endocrine system. Who coordinates the endocrine and the nervous? Because they're both combined. What's the coordinating center for the nervous and endocrine system? You know, when our bodies respond to certain internal and external stimuli, when stimuli is coming in, whether it's coming in from the outside or it's already inside, what is the coordinating system? Okay, that was a big clue right there. What is the coordinating system? You need to know how endocrine hormones work, whether it's endocrine or exocrine. Pretty fair, right? Got to know the difference between endocrine, exocrine. When a patient has abnormally low serum calcium levels, what's involved? What systems are involved with abnormally low calcium levels? What is homeostasis? Explain to me, when a patient has diabetes, explain insulin and what does it do with the cell? How does insulin and the cell work, or how does it not work with diabetes? What does insulin do when somebody has diabetes? What does it do to the cell? I need you to know about estrogen. That's a pretty broad topic. Let me narrow it down a little bit. When estrogen enters the cell, it'll react with, like receptor sites inside the cell to make changes and produce an action. What type of action does it produce? Can you repeat that? Yeah, estrogen. What type of action does estrogen produce in the cell? The patient's response to pain perception. what gland is affected, and what gets released. So when a patient has pain, what gland gets affected, and what gets released from that gland in response to pain. And I'll tell you guys, I would not use Google or ChatGPT to get this answer, or any answer for that matter. Literally go back to your book. If you think you're saving time, well, it's quick. You'll get a quick answer, but it might not be the answer that's in the book, and therefore, not the right answer. You can argue all you want with me. I'm gonna go right to the page of the book to show you where these answers are at. So what you do is you just go to your index, look up pain, go to the chapter, and oh my God, read a little bit. Negative feedback system in the endocrine system. What is the negative feedback system? What does it do? What is the negative feedback system, and what does it do? What's the goal of it? What's the goal of the negative feedback loop? If a client has a disruption in the metabolic rate, what type of diagnostic test do you think they're going to do? When we talk about somebody's metabolism, what are we really talking about? The gland. What gland is involved with metabolism? Find out what gland, then figure out what test would I do to see if this gland is working. The drug Leuprolide, Leuprolide. What is it used for? And what signs should you monitor for? Now let me just say this, people. I know there's a lot of signs and symptoms, there's a lot of adverse. But when we ask a question about what should you monitor for, realize I'm asking what is the most important. So if it was between nausea and vomiting or pulmonary edema, what do you think is more important to monitor for?
Pulmonary edema.
Exactly. So you can't say, well, nausea and vomiting, yes, it is. But what's more important, nausea and vomiting or pulmonary edema? It's going to be pulmonary edema because that's breathing, airway issues, your ABCs, airway, breathing, circulation. Somatropin. Why would you give somatropin to an 11-year-old? When you figure out why you're using somatropin, what is a consideration to stop the drug? So I'm asking a twofold question. Why are you using the drug, somatropin? And if you're going to use it, when should you stop it? We talked about that several times. DDAVP. It's also called desmopressin. DDAVP is desmopressin. What is it used for? What assessment finding would signify that it's having a therapeutic effect? So I give a drug, I need to know if it's working, I need to know if it's having a therapeutic effect. What would that therapeutic effect of desmopressin be? Desmopressin, DDADP. Hold on a second, I get a student who wants to review the word. Alright, DDADP, desmopressin. What's it used for? If I give it to somebody, how do I know it's working? What do I assess? I'm giving it for a reason. If I'm giving it for a reason, I need to know if it's working properly. Again, somatropin. There's reasons why we give it. Like some drugs, we're giving it for two different causes, different issues. You need to look up somatropin and know why we're giving it and for what different types of patients are we giving it for. Okay, glucocorticoid, really important drug, glucocorticoid. Why do we give glucocorticoid? I mean, you can find, it's given from everything from A to Z. And I'll give you the answer because I think this is really important. Glucocorticoids are given to decrease inflammation, but across the spectrum. Could be your eye, could be your toenail. I mean, really everything from A to Z. It's to decrease inflammation. The question is going to ask, glucocorticoid, you need to know the adverse effects. So what's the bad effect? There's a lot of bad effects of glucocorticoids. And I'm going to ask, what would be a nursing diagnosis you would use? So you'd have to know, what is the adverse effect of a glucocorticoid? So therefore, what is an adverse effect? What would be a nursing diagnosis? Okay, we got a baby with diaper rash here. Okay, so this baby has diaper rash and they're using a steroid cream. I need you to get into your book. And I can see the page. There's a page that talks about, and it's in a table where it goes over children, older adults, because there's certain things with steroids, especially topical steroids, with a child that you have to be familiar with or aware of. Thank you. What do you want? This is a nursing program. Why would we have a Band-Aid?
Just like it.
So I can't give you any more help than that. You have a child who has a diaper rash. There's topical steroid that's been ordered. How do you give it safely? It's unfortunately a select all that apply. So you need to know different things about how to give this drug safely to a child who has a diaper on, who's getting steroid cream, okay? That'll be it. Okay, we're getting a patient who has high dose corticosteroids. If somebody is getting a high dose corticosteroid, doesn't matter what the problem is, how does it tie in with them getting a vaccine? High dose corticosteroid and vaccines. What is the issue there? There is an issue. If a patient is steroid dependent, let's say they have adrenal cortical insufficiency, their adrenal glands aren't producing enough steroids. That's what happens. So then we have to give them exogenous steroids. So they're steroid dependent. In times of stress, I like to group it trauma, infection, stress. What happens with trauma, infection, and stress? What happens to a patient who is steroid dependent? You have a patient who's steroid dependent and has a very stressful situation. What will happen to their dose of medication? What can you anticipate? When someone's taking glucocorticoids and they've been prescribed aspirin, is there an issue? What's the issue? What should be done? You know, you're looking up a patient's MAR, okay, medication administration record. Patient tells you, yeah, I've been on glucocorticoids, and I also take aspirin for a headache or whatever. There's a problem there. What's the problem? Okay, so you gotta know this glucocorticoid stuff is pretty important. The nurse is providing education to a client who is taking glucocorticoids. What would a nurse instruct the patient? Should they take it with food? Should they take it in the morning or at night? What foods interact with it? This is all a part of giving meds safely. How do I give glucocorticoids safely? When's the best time to give it? Why? Why is there a best time? Okay, we have an older adult with diabetes. They're also receiving oral cortisone. What would be a priority? Somebody is on hydrocortisone and diabetes. What happens when somebody is on cortisone and they're also a diabetic? What happens to their blood sugar levels? All right, another select all that apply. We have a patient with adrenal insufficiency. They're in adrenal crisis. You better look up adrenal crisis. What is adrenal crisis? What's happening? Select all that apply. What's happening in adrenal crisis? What would you see? What are the signs and symptoms? This is a select all that apply. So there's more than one sign or symptom. Look it up. newly diagnosed hypothyroid patient. Hypo, low. You have a newly diagnosed hypothyroid patient. What type of diagnostic testing would they do? What tests are you running on a patient? What lab work? What deficiency, what hormone deficiency does a patient with hypothyroid have? If a child gets diagnosed with hypothyroidism, what med do you think a child would be on? Alright, you have a patient who has atrial fibrillation and has been prescribed an oral anticoagulant. What's the reason for it? Why would someone with AFib, why would they be prescribed an anticoagulant? We're going to go one step further. If you have a patient who is on anticoagulants for AFib and has just been diagnosed with hypothyroidism, what's the problem? From a medication standpoint, if they're on anticoagulants and they're on hypothyroid medication, there's an interaction. There's a drug interaction between anticoagulants and hypothyroid medication. What is the interaction that I need to monitor for? And it's a priority. Okay, there's a lot of interactions, but there's a priority with both these meds. Okay. What is Paget's disease? P-A-G-E-T-S, Paget's disease. What medication would be prescribed for Paget's disease? What common adverse effect occurs when given this medication? Common and expected. The patient will say, I'm having this symptom. And you would say, that is a common side effect from the medication. How would you look this up? Like when you go home, how are you gonna look this up?
I go in the index.
Thank you. Gonna go in the index and look up Paget's disease. I know that sounds silly, but I'm gonna tell you, some students do not know that the index is in the back of the book. I kid you not. I didn't realize that. I took it for granted. And they're like, how are you finding the answers to these so quickly? Because they're thumbing. I said, go to the index, look up Paget's, and they're like, what's an index? No, I know. I would expect a college student to know, but you know, if no one ever taught you, then it's not your fault. You had a pretty shitty teacher somewhere along the line, all along the line, who never taught you that. So I don't want to assume people know that. All right, you're the patient who has type 1 diabetes, and they constantly are having hypoglycemia, which is low blood sugars, late in the morning. What could be the cause of this late morning hypoglycemia? What would make blood sugars drop late morning? What could be happening? Client's gonna tell you, I do this, Before I do that, and you need to be able to choose what would cause a blood sugar to drop. And the answer isn't they're taking too much insulin. That would be too easy. Alright. Hypoglycemic reaction. To select all that apply, what are the signs and symptoms? What are the manifestations? When I say manifestations, I mean signs and symptoms of hypoglycemia. You need to know all the signs and symptoms of hypo. You also need to know hyper. Select all that apply. So no hypo, hyper. You're gonna get one of them. The drug pramlintide, Pramlintide, is being used with insulin therapy. What instructions do you need to give a client to safely take this medicine? Patient has diabetes, they get insulin therapy, but they're also prescribed pramlintide. How is the drug given? And what teaching do you need to give this patient? Priority teaching. More than just, you'll have redness at the injection site, okay? The shot will hurt. Something a little more significant than that. You have a patient with diabetes who has developed diabetic retinopathy. What caused diabetic retinopathy? What's the reason for diabetic retinopathy? What is happening on a cellular level? What is hemoglobin A1C? Why is hemoglobin A1C better than a random glucose finger stick? We have hypoglycemia in a patient. The level is 20. What drug would you anticipate to be given? You have a blood sugar of 20. What medication can you anticipate the doctor ordering? And again, keep in mind, it's pretty low obviously, right? Keep in mind that if you have a patient who's low, are they awake or aren't they awake? That comes into play, and you gotta know why. Why is that important? Orally, right? What's the problem with a patient taking insulin and propranolol? Insulin and propranolol. Gotta know what propranolol is. Let's just say it's a, thank you, beta blocker. What's the problem with a beta blocker and insulin? Or a diabetic? Critical thinking. What is the fastest acting insulin? The fastest. So you're going to be looking at the onset. So go to your insulin page, figure out which one has the fastest onset of action. You have a patient with type 1 and type 2. I need you to know the difference between type 1 and type 2. If you were doing instructions to a patient who has type 1 diabetes, what would you say to someone who has type 1? What do you know about type 1 versus type 2? I'm asking you, what's the difference between type 1 and type 2? Teaching's going to be very different. We have a patient who's in DKA, diabetic ketoacidosis. You need to be able to explain what DKA is. I can tell you their blood sugar is 500, and they've been prescribed 25 units of insulin. I need you to tell me what type of insulin do we give to somebody who's in DKA. This is a serious situation. DKA is very, very serious. It's important. The doctor says, give 25 units of insulin, because that's what he's going to say, because he expects that you will know what insulin. Okay, we have polycystic ovarian syndrome. What type of drug would we use for this? We have a patient who has recently become pregnant. What hormone maintains pregnancy until birth? There is a hormone that allows you to maintain your pregnancy. You need to tell me which levels, which hormones. What hormone causes ovulation? What hormones cause the uterus to contract? What hormone causes the uterus to contract? What causes your menstrual cramps? What causes your menstrual cramps? We talked a little bit about testosterone, and I can see on that page what testosterone can do in males. We talked a little bit about the hemoglobin and the hematocrit. Explain to me, because remember we talked about women and men have different normal levels of an H&H. The women's are a little bit lower than the men. I need to know why. Why is a man's hemoglobin, and specifically hematocrit, higher than a woman's? We have a client who has just started taking oral contraceptives. What is the risk factor for a woman taking oral contraceptives? What are the risk factors? What would you ask a client before starting oral contraceptives that might make a provider change their mind about prescribing an oral contraceptive to a woman? All right, we're in the dreaded menopause. What combination drug would be appropriate? What drug would we give for somebody in menopause? We have a nurse caring for a patient who has a subdermal implant of estrogen. How often are we replacing? It's called etanogestrel. etanogestrel. This subdermal implant. What teaching would be of concern if a patient has been taking hormone replacement? What would be of concern? And I'm thinking about blood clots. A patient is more at risk for a DVT, deep vein thrombosis, if they're also doing another maladaptive behavior.
What's the drug?
It's a hormone replacement. We have a patient, an adolescent, who has been diagnosed with hypogonadism. What is hypogonadism? What medication would you expect to be prescribed for somebody who's hypogonadism? What is the side effect of this medication? Think about it. If we're giving this to an adolescent, they're really concerned about body image. This medication causes a problem that might make it worse. What is that problem? All right, we have a postmenopausal woman who just got diagnosed with breast cancer. She's going to be treated with methyl testosterone. Why? Methyl testosterone. Why are they treating her with this? And what would be an adverse effect that you would say, if you experience this sign or symptom, call the doctor? What is an adverse effect that would prompt you to say, if you experience signs or symptoms of this, call your doctor? Obviously, something more than nausea and vomiting, right? We have a child who has renal failure, and they're on androgens, and they're on it to promote red blood cell production. What is the adverse drug effect of androgens? What should we monitor for? A child taking androgens. What would the nurse monitor this child for? All right, we have a male client who takes what does he take? All right, he has angina. So we should know what med he takes for angina. Male patient takes a medication for angina. He also has prostate enlargement and erectile dysfunction. It's got that trifecta, okay? Then he asked the nurse, can I take Viagra? What would be a reason why he shouldn't? So knowing he has angina, knowing he has prostate enlargement, knowing that he has ED, You're at that. What is the problem with all three of these? If he's taking meds, if he's taking meds for all three of these, what's the issue? We have a client taking anabolic steroids. Doesn't say why though. What do we need to monitor a client who's taking anabolic steroids? They do have a lot of adverse effects, but again, one of these could indicate that either there's liver involvement or kidney involvement. And the next health bills. I had to add 5 math questions on here. I only want a 50 question test, so I'm gonna have to probably get rid of a couple of questions in order to fit math questions.
Don't select the all out of 5 ones.
Okay. You're gonna need to know again, I'm gonna go over the math with you. Gonna give you iron oats. We're gonna say he had 4 tablespoons of apple juice. He had 3 ounces of beef broth. You need to know how many mLs are in ounces. How many mLs are in a teaspoon or a tablespoon. That I'm leaving on there. You guys should know the difference between a microgram, a milligram, a milliequivalent. Forgive me. Giving pills. You gotta know, you're gonna have to know grams to milligrams, micrograms to milligrams, basic metric conversions. I'm gonna ask if you have to give 10 milligrams of a drug and it becomes 50 milligrams per ml. Don't write that down, I'm making numbers up. Okay, so drug over half times supply or your dimensional analysis. But that's the formula you're gonna use to figure this out. Make sure you read the problem carefully, know what is it asking me. Do math problems twice, check your work, okay? Alrighty. Good luck.
Thanks a lot.
Thank you.
I didn't know how to do simple, and I was already in the middle of it. I'm like, I'm so sorry.
I'd be like, no, it's okay. Yeah, I guess I do.
Who did not hand in
Oh my God.
your drug card?
Oh, I have not yet.
Okay,
I have it, but
okay.
I'm
When
gonna
am I
give it
gonna
today.
get it? By Friday?
Today.
Today, okay, beautiful.
Now you're mine are all like.
Thank you. It smells like Brooklyn days. Oh yeah.
Good luck, guys, on your exam. Listen, your biggest problem that I see is you guys are answering too quickly. I can see how quickly you're answering my questions, and for a 50-question exam, the average was 37 minutes. I can tell you right now, you can't do it. We're going too quick. Slow down, all right? Read the problem twice, and the answers. When you go to read the answers from top to bottom, and say to yourself, what is this question asking? Then read the question again, go from the bottom to the top, then answer, okay?
job is it?
The one outside. The one that we're always in, I think.
Huh?
The one that we're always in. Huh?
I don't know.